Hello, everybody. Dr. Alfred Marquez, Integrative Dental Care of El Paso, coming at you a little bit late today, but I guess that's kind of the way it is when you're a celebrity. Just kidding. Um, I've been away for some time. Fun Fact Friday. Lots of stuff going on with the holidays and all that, and I'm sure that you all know what that's all about. But we're back and we're going to try to do this every Friday, Fun Fact Friday, bringing some information to you, a little bit about us. We're a general dental practice. We're do all phases of dentistry. Our goal is to provide five-star treatment to all our patients. We invite you to come see us if you are in need of dental care, you, your family, your friends. Reach out to us, and that's Marquez Integrative Dental Care of El Paso. Topic today, TMJ, clicking, popping, and more. So what is the TMJ? First of all, TMJ is our temporomandibular joint. We have two joints, one on either side. Believe it or not, lots of problems that come from that and things that we're seeing. It can express itself in very different ways. So I'm going to touch on that a little bit. We've become somewhat of I don't want to say experts, but I would say efficient in treating temporomandibular joint disorders, or TMD, and they can express themselves in different ways. One of the things is popping and clicking. Is popping and clicking a problem? It can make noise that's very annoying to the person, and sometimes people will come in and see us about that. But just because it pops and clicks doesn't mean that things are going to fall apart and that you necessarily have to treat it. It's up to the individual, it's up to the person, but there's certain things that come with a popping and clicking that we will look at and see if those things are compromising the teeth. The whole thing is how do they compromise the patient and what should be done or not done. For sure, if there's pain associated with popping or clicking, then it should be addressed. And again, it's a very individualized thing, but we can help you sort through all that. Maybe there's wear on the teeth, maybe there's fracturing, maybe there's chipping of the front teeth, which then could be associated with the temporomandibular joints, and it goes deeper than that. But wear of the teeth can be a big issue. It can result from nocturnal or nighttime clenching, grinding, or even daytime clenching and grinding. What about pain? What about pain that results from our temporomandibular joint system, if you will? Well, there can be several types of pain. It can come directly from the joints. We have capsules in our joints, each side, that can become inflamed and painful. Sometimes it can be acute, meaning it's just sort of a sudden onset. Maybe a person that was playing basketball got an elbow in the chin and now their joint hurts, or maybe they were in some kind of accident. Maybe there can be pain that comes and goes, but the key is diagnosis, looking at it, seeing what that pain in the joint is actually coming from. Sometimes you'll have a person that has clicked and popped for years, and all of a sudden their jaw starts getting stuck when they open and go, they have to move it side to side. And then maybe there's one day where they wake up and they say, I can't open my jaw. My jaw has locked in what we call a locked close. They can't open. Well, the jaw can be unlocked. There's techniques that we now have where we can address the locked jaw and correct it and make it functional once again. So locking is certainly something that can be treated now. Other things, what about pain? Different kinds of pain. There's what we call myalgias. That's muscle pain. It can be muscles of typically it's going to be here on the side. It'll be the temporalis muscle or the masseter muscle, or the muscles here on the side. It can be on the neck or behind the head, and those can be painful. It can cause headaches. They can be mild. They can be severe. Those type of pains can lead to what we call myofascial pain, which very often exhibits itself as referred pain. What is referred pain? It's like a person that has a headache right here. They say it hurts right here, but realistically you touch here, there's really no muscles that would get sore, but then you find that it's being referred from the back of the head or maybe the neck, and it refers a pain and makes you perceive the pain up here. You can have pain that originates from trigger points on the temporalis muscle. It's a muscle here on the side, and it can refer it to teeth. So a person will swear that the pain is coming from a tooth, and sometimes we've seen a person that says it hurts right here on this tooth, but then when we look, they don't have a tooth there. They perceive the pain that's being triggered from maybe a muscle up here, or maybe even the masseter muscle very commonly. So the key to treating issues with the temporomandibular joint is to develop a great diagnosis, listen to the patient, talk to the patient, see what bothers the patient, and then start dissecting and looking for solutions. So if you or anyone else you know has these kind of issues, be sure to reach out to us. Marquez Integrative Dental Care of El Paso. You can follow us on Facebook, Instagram, Google. What else? Our website, Marquez Integrative Dental. We have a lot of videos that are on there that might be helpful to you. And if you have any questions, just reach out to us. So thank you very much. Have a wonderful day. Thank you.